welcome to the We Talk Health podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and joining me in the studio today is Chandler Haynes and Dianne Sherrod. They work for the West Tennessee Healthcare Foundation through the Jackson-Madison County Prevention Coalition. And they're here today talking about another pandemic that is kind of sweeping the nation outside of COVID-19, the opioid pandemic. So before we dive into that, I'm going to get to know them a little bit better. So Chandler, Dianne, what's up? How are you?
I'm good. Well, how are you?
I'm good. Thanks for coming in today.
Good morning.
Good morning. So just tell me a little bit about yourselves. Who are you? What do you like to do outside of work? What do you do for work? What's your role in your department? And we'll kind of go from there.
Yeah. Well, Will, we know each other through, just outside of work things.
Shout out West Jackson Baptist Church.
Exactly. So, yeah, man, I just, I'm born and raised here. Love Jackson, love West Tennessee. I have a real heart for the people here and just the area. Mm-hmm. And, I like to fish, hunt, whatever. But I also like to sit at home on the couch, too. One of my favorite things.
Love it.
Exactly. So I'm a couch potato and a, self-proclaimed country boy / redneck. So
nice.
We love it.
And you're getting married soon?
Dude, I get married in 11 days.
Oh,
Counting down.
It's getting real, people.
So the what date specifically?
July 2nd.
July. Okay, my math is not great, especially at 10 a.m. on a Tuesday. So July 2nd. That's coming up quick. Mm-hmm. Oh, cool. Chandler, I'm glad you're here today. Glad you reached out to me about doing this.
Yeah, thanks, Will.
Ms. Dianne, who are you?
So, I too were born and raised here in Jackson, and I work in accounting by trade.
Okay.
I worked in the hospital accounting at HCA Regional for years, and then I also worked for the Madison County Finance Department and also the Jackson-Madison County School System.
Okay.
One thing about me is I'm a person in long-term recovery. Mm-hmm. I have recovered from alcoholism and drug addiction. I'll have 19 years in September.
Wow, congratulations.
So one thing that I'd like to do when in recovery, we have this altruistic movement where we try to give back and help others. And someone came to me back in 2017 and said, how would you like to help people all day long and get paid? And I was like, there is no such job, but there was.
Yeah, that's awesome.
We work for a state-funded agency called the Lifeline Peer Project. And one thing I'm grateful for is we work for a governor, the past two governors actually, who have been very supportive of, people with substance misuse and alcohol misuse, and particularly with the opioid epidemic. They have provided funding for programs like the Lifeline Peer Project, which is what I do. I'm called a Lifeliner. There's 17 of us across the state. We work by region. Mm-hmm. And I cover the Southwest region, 11 counties. So I was able to come to work and help people just find detox, treatment, recovery. All of us, the 17 of us, we actually know where all the state-funded treatment beds are across the state. Mm-hmm. And we pretty much get those filled up by lunchtime every day.
Wow.
I mean, just,
amazing.
Just a network of, coming together, people who need resources, and we have a thread going by chat, by email, and we help people, find recovery resources. So it's a great thing. It's a wonderful job, and I have a great team. Chandler has just joined our team, and I'm so excited to have him aboard. We also have Sarah Mays, who is also the hybrid lifeliner. She actually covers some counties in Southwest Tennessee that are distressed.
Okay.
And then we have Amy Bechtel, who is our community faith-based coordinator for all of West Tennessee.
Awesome.
So she serves 21 counties
Wow.
in West Tennessee, and she moves in and out of our congregations, and she signs our churches up to be recovery congregations. She does all kinds of trainings like mental health first aid, ACEs, resiliency, trauma-informed approach. Yeah, so, as a team, basically our job is to provide people with resources and to educate and inform people about stigma and about the crisis that we're currently facing.
That's amazing. So I see on your titles, both of you are regional overdose prevention specialists.
Yes.
So if you could just kind of give me like a nutshell what that is. I think you may have alluded to it a second ago, but
Yes.
Right. So just like, Dianne mentioned, she's a Lifeline, but she's also ROPS. So she's she gets the best of both worlds. She gets to do both. And I've been with her on some Lifeline kind of street outreach things, but regional overdose prevention specialist is more of a formal training role, I guess you would say. When I say formal, I don't mean, suit and tie. That's what you have to wear to come. I just mean that our job is to go out into the community to raise awareness and to train on opioids, stimulants, and how to reverse those types of overdoses using a life-saving drug called naloxone, which is the generic name. A lot of folks will recognize it by the brand name Narcan, and that is what you can ask for at a pharmacy, and that is actually what we provide to certain people that might be in danger or living in close proximity to someone in danger of overdosing from opioids.
Okay. What exactly is naloxone? Like, you said it's a life-saving drug. How can that, as somebody who doesn't know, how does that save people's lives?
Right. So we work with a gentleman named Mark Mason, and I'm going to put this in, one of his favorite things to say when he's explaining is, I'm going to put it in simple language.
Please
simple language. That's what he says. So essentially, if you can think of, do you remember when we were younger, you would watch Grammar House Rock or
Schoolhouse Rock,
where they teach you like about conjunctions and all that. Okay, conjunction, junction, right? Hooking up phrases,
function.
clauses, and functions, right? That's what they would say.
Yeah.
So it's kind of like a train yard where every train would connect to each other and it would carry something off. That's how opioids work in our brain. That's how every chemical works in our brain, right? So when you ingest something, certain things bind to other things in your brain called receptors, right? So opioids, they slow your breathing down. They're a pain reliever, right? So they're very, very often used for post-surgery for pain, right? If you're elderly, let's say, and you fall and you break something, they'll give you that to help you, or even if it's a big heart surgery, My fiance works for Jackson General, and they give opioids to people after they've had bypass surgeries, open heart surgeries, whatever. And so the problem comes in when too much of something is consumed and it's a toxic amount, and that's what we call an overdose. And so with prescription opioids, we don't really see that as much, but what is really happening is that there is this very potent chemical that is an opioid inhibitor, meaning it causes more of it to be produced in the brain. And so just like conjunction, junction, when you take something, it takes up all the room on your brain and those receptors.
I see.
And it fills them up with that chemical, right? So what naloxone does is when someone has consumed too much of a substance, opioids only, that's all that naloxone works for, it will basically come in and it will say, hey, I'm driving the train now. And it will unhook all the opioids from the train car, and it will bring that person back to life so they can start breathing again if they've consumed a toxic amount of opioids.
I love that metaphor that you made. That made so much sense. Yeah,
I'm going to take that with me too.
Yeah, for sure. So Dianne, off mic, you and I talked about there was a change that happened and how doctors prescribed painkillers. So can you kind of describe what that change was?
Well, just looking back at the history of painkillers, the first thing I want to say is there's a trick. It's a myth, and it's probably one of the greatest hoax that was ever played on the American people and people worldwide. Opiates have been called painkillers, and the trick of that is it's not a painkiller. It doesn't kill pain. Opioids will mask pain, but the pain returns when the medication wears off. So if you've had surgery, or in my case, when I was in a car wreck and I was overprescribed opiates, and when they gave it to me, I was like, oh my God, my pain is gone. I feel so much better. I was like cleaning my house. I was, it just seemed like it just was this miracle drug.
Yeah.
And after 30 days, I went back to the doctor and I was like, wow, that really worked. And of course, doctors are like car salesmen. They want happy customers, right? So they prescribed me more. After about 6 months, 8 months, it seemed like it started taking more of the same thing for me to get the same effect. So I went back to the doctor doctor, and I was like, you know what? I'm not sure if 30 is going to do enough. Can you make it 60? And he was like, sure. And so the birth of overprescribing began for me. And by the time that I realized I had a problem, I was probably taking 12 to 15 pills per day.
Wow.
Now, a doctor's not going to prescribe that many.
Right.
Now, they will
Sure.
overprescribe. So back in the early 2000s when this was happening to me, they didn't have databases in the pharmacies and in the doctor's offices that was tracking your prescriptions. So I did this thing called doctor shopping and pharmacy jumping, where I was going from place to place just to get more medication to get the same effect. And what people need to understand is if someone has an injury or a pain or a toothache or a surgery, the human body is a remarkable thing. It has a healing power, and pain is an indicator of healing. So if you're masking that pain, then your body's not really going through the healing process like it should, although you think it is because your pain goes away when
Right.
you take that medication.
Right.
So what happened was I was going through this thing called opioid withdrawal syndrome. It's called dope sickness, and it's basically feels like the flu times 100, okay? Body aches, nausea, diarrhea, joint ache, chilled, sweating. It's the worst feeling in the
Wow.
world. And the problem with that is that people were tricked. They thought that they were really having their original pain. They weren't able to differentiate the original injury or pain from the opioid withdrawal syndrome. It played a trick on my mind, and I thought I had to have it because of my original injury, which had healed years before. So once this started happening and the overprescribing became so paramount and people started seeing where opioid prescriptions were written. Have you ever watched that show, The Pharmacist, on Netflix?
I've not.
It gives a really good depiction. It's a good illustration of really the opioid crisis in its infancy.
Okay.
This pharmacist who had lost his son to drug overdose was noticing that these perfectly healthy looking people, 17, 20, 25 years old, were coming in getting these opioid prescriptions filled, 60, 90, 180 at a time, but they didn't seem to have any injury. And what happened was there was a doctor that was overprescribing, paying cash for this medication. They were making they weren't getting insurance or anything. They were just making their patients pay cash for this medication, and they were selling it on the street. The street value rocketed.
Wow.
To get FDA-approved pharmacy painkillers. So, of course, our lawmakers got involved, and what happened was in 2018, they passed new laws that said, okay, from now on, doctors cannot overprescribe opiates. They can only prescribe a 3 to 5 day supply. And if you need anything more than that, you have to go to a pain management clinic. Well, you would think that would have cured the problem, but the problem was these were people who were addicted. They had opioid use disorder, although they probably didn't know it. They just thought they were still suffering from their original pain or injury. But what happened was it cut these people off from their medication. They started going into the opioid withdrawal syndrome, and this is a syndrome. If anyone has ever been through it, you will know that you will do anything to get one more pill, because one more pill will remove all of that sickness. And when I do, Loxone trainings, particularly in our church congregations, when I do those, and I'm talking to these people, and they've got loved ones who they say, they're angry and they're agitated and they're grumpy, and they go to bed and they're like in this fetal position, they won't come out, and we don't know what to do. And then all of a sudden they come out and they're fine, and we think the problem is solved. But what happened was they got one more pill, and the symptoms went away. And that lasts for probably 6 or 8 hours, and then they're going to be right back into that vicious withdrawal syndrome. So what we do as regional overdose prevention specialists is educate people on what happens when someone's cut off from their medications. The pain management clinics I was talking about back in 2018, when they actually were sending all these patients to these pain management clinics to get more medication, which is what everyone wanted, they started overseeing what was going on in the pain management clinics. And in 2018, they closed 21 pain management clinics across the state. Now, these were clinics that were seeing anywhere from 350 to 1,000 patients a month.
Wow.
And now, not only are these patients who are our grandparents and our family members and people in our congregations at our work, they're all cut off from their medications. So they start moving to the street for illegal drug purchases because fentanyl and heroin is also an opiate, which is also cheaper and more readily available. It's illegal, but you can get it from the street. And that's when we started seeing the increase in overdoses, when people started going to the street for these purchases.
Right.
And
So-
unable to get them through the pharmacy.
So what's the effect of fentanyl? You mentioned that drug a minute ago,
Okay,
and
so
we've heard it a
fentanyl,
ton.
Yeah, I mean, that's what I think everyone's talking about
Right.
today. I mean, the stats show us that in Tennessee, there was over 3,000 overdose deaths by opioids last year, and 1 out of 3 involved fentanyl.
Wow.
So fentanyl is a synthesized opiate. It's not what you would call pharmacy grade, not what we're talking about. It's not a pharmacy grade drug that you can get in a pharmacy. It's actually synthesized in labs in China and other places, but China is the primary source.
Okay.
And you can get it through the mail. You know, just go online and you can order it and have it sent to your house. And what we were finding was that drug dealers started cutting their products, their heroin and their other products, with this fentanyl, which is supposedly gives you this really huge euphoric boost, like more so than heroin. It's more potent than heroin. It's more potent than painkillers, and the boost that you get is so addictive. Then you just continue to chase that. Everything, your whole mindset changes. The receptors that Chandler was talking about in your brain, those pathways are redefined in your brain that makes you want that drug as much as you would want to eat or drink. It takes over your mind, and it takes over your body to where that's all you can think about is how to get more, which is what's causing people to commit crimes and rob and steal to get more medication. The problem with fentanyl is if you get a peel-pressed fentanyl pill that looks like a Percocet or an OxyContin and you don't know that's what it is, then if it's a lethal dose, then you will die, and you have no idea that that's what you were using.
Can one pill be a lethal dose?
One
yes.
pill can be a lethal dose.
Oh, yes.
Really?
And the problem with that is even the drug dealers don't know what they have. They really don't. They're getting these pills pressed from these places. One thing is I wanted to talk about was, when I first took this job in 2017, I had provided services for a lot of peers, and I probably maybe lost 3 to 5 people to death by overdose in the first 2 years. In 2020, since March 13th of 2020, I have lost 177 peers to death by overdose, usually poisoning by fentanyl. And do you remember what happened on March 13th, 2020?
I remember the world shutting down because of COVID.
Yes, but one of the first things that happened was the first stimulus checks came out.
Oh, yeah.
So what happened was not only did people who might have been clean from a drug addiction, what I found in my peers were there were several who died from overdose who had 6 months or longer clean. But when a drug addict is given money that's extra money that they're not expecting, they tell themselves, okay, I'm going to pay the rent, I'm going to buy groceries, I'm going to pay off this bill, but I'm also going to say, one more is not going to matter.
Yeah.
Right? I'm going to go talk to my guy about getting one more or getting, a bag of pills.
Yeah.
The problem is all drug users in one area in our community got that money, and the drug dealers didn't possibly have enough supply to meet their demand. So that's when we started seeing a lot of cut products, that were cut with things that were killing people. And one thing that I did notice after the second stimulus check went out is, the drug dealers got that money too. And one thing I think the narcotics teams and people were noticing was that the pill-pressed fentanyl, you used to be able to see a pill-pressed fentanyl and recognize it. It would crumble, it wouldn't be sealed,
Okay.
and you would know that it wasn't a pharmacy-grade pill. But now, the pill-pressed pills look just like the pharmacy-grade pills. You really can't tell the difference. So people who thought they were getting smarter in, buying the drugs that they were buying, it wasn't smarter. They, those pills were still killing people.
It was camouflaged.
Like real pills.
Wow.
Yeah. So that's what we're facing. That's the crux of the opioid overdose, and that's one reason why, our government, our governor has provided funding to not only for us to be able to give naloxone, and what we provide to people are 4 milligram nasal sprays. And we provide training on how to administer the nasal sprays to reverse the opioid overdose. And we're so grateful that we're able to do that. I know there's a lot of talk and a lot of discussion about medications that are free and medications that are offered, to reverse the drug overdose. But, one thing that we have done, what's the number now? I think it's 76,000 people have been given a second chance at life.
That's amazing.
Because their overdose was reversed through naloxone. So even though our overdose numbers are staggering, over 3,000 just last year died from overdose, we still have a lot of people who have gone on to treatment. That's one thing I love about having this job along with my Lifeliner job, is not only am I able to provide, and Chandler does the agency trainings, law enforcement, first responders. I do more of a street outreach, which I spend a lot of time in the hotels and motels, like close to the interstate, where there's a lot of people who live there, and their drug dealers live there, and they have drug problems, and they live in these hotels where it's rampant. So I'll go around to those hotels and I'll give out Narcan to people. To just say, just hold on to this in case you see someone who might be experiencing an overdose. Yeah. And I train them. I do like a little brief training where I show them a video and show them how to administer it. So that's pretty much what I do. Gotcha. But one good thing about that, for having twofold job, is I'm also able to talk to them about detox options,
right?
And because I know when all the detox beds are available every morning, and I know what's available at Pathways, or if they have insurance where they could go. So that's one good thing I'm able to do, is provide treatment and detox options to people who might be ready finally to make that change.
Yeah, I was going to ask if you guys work with Pathways directly.
Yes, I do every day.
Yeah, wow,
yes, I do.
That's awesome.
We're doing a training with them actually at 1:00 today.
Oh,
awesome.
I'll be in attendance to watch Mark, like I mentioned, gentleman Mark Mason that works with us. He's conducting it. So, work with Pathways hand in hand.
That's awesome. Earlier you mentioned a pain specialist. Several of them were shut down, but
we do have pain specialists here in Jackson, and they do follow the regulatory guidelines now.
Gotcha.
Because there are people with chronic pain. We can't forget that people do have chronic pain,
right?
And we have to be able to. What I like to try and provide focus to is I'm not trying to tell a doctor how to do their job, but I do think doctors should provide more holistic approaches, or the pills aren't always going to be the answer.
Right.
Of course, exercise, diet, and holistic options can always be better than an opiate. I have been to the dentist, and I've had to have a root canal and stuff, and I will take 800 milligram ibuprofen that will knock out any pain I'm having. I will never ever take another opioid, because I would never want to set off that craving in my head, because the pathway and the receptor is already there. To overcome that addiction doesn't mean that that craving won't be set off if I ever take another opioid.
Right.
Because it will. So looking at other approaches, like just over-the-counter, or even, nutritional or herbal remedies like vitamins, things like that, chiropractic medicine, acupuncture. There's a lot of different alternatives we can look to instead of prescribing a painkiller to help people with chronic pain.
That's amazing. What are some signs that people could look for if they suspect opioid abuse, say in your friend group or your family, or really anywhere?
Right. So when you say abuse, you mean like an overdose?
Overdose,
like someone overdosing, yeah. So there's a couple things that you look for. So I want to go ahead and clear up what the difference is between misuse, like you just said, and also an overdose, because misuse is more of a chronic, long-term condition, right?
Okay.
That's dependency, right? Like if a cup of coffee, right? How many people have you talked to that say, I'm no good until my first cup of coffee is hit. Right?
We had that conversation
Yes, we
before
did.
the mics turned on.
Right. And so why? It's not because that coffee controls your life, surely, right? Like it's not calling the shots. Or in your brain, is it your brain's, hey, listen, you didn't give us that caffeine we need, so we're not gonna kickstart, the jumper cables aren't connected until we get that caffeine is basically what's happening.
Yeah.
And that's when you have a dependency on some kind of substance because your body's used to it being there, right? And so misuse is can lead to an overdose, right?
Okay.
And when you're following, what your doctor's orders are, if they're managing it properly, if they're following the guidelines and they're monitoring you, we don't see, overdoses from prescription medications as often if they are being followed by doctor's orders. But there's a caveat, the little star next to that. Will people follow, right? Will they follow what their doctor is saying if the doctor's following what they're supposed to be doing? Mm-hmm. So an overdose is when a toxic amount of a substance takes over your body, right? And it's not just opioids. You could overdose on anything you take, right? Mm-hmm. You could take 10 things of Tylenol, 10 Tylenol tablets, and you could destroy your kidneys and your liver, right? Mm-hmm. And so I've talked to people who work in healthcare about that. But essentially with an opioid overdose, what you're going to be looking for is you're going to be looking for someone who's more than likely unconscious or barely in and out of consciousness, regardless if they're on the floor or if they are on a couch, on a chair, whatever. They're just going to be visibly not present, in what's going on around them. When you approach them, right, they could have shallow breathing. That's what you're going to look for. Shallow, disturbed breathing. You could hear a gurgling sound, kind of like if they were maybe choking on something, or if anyone with sleep apnea where their airway closes at night. It's my dad, he snores like a freight train, right? Yep. So he has to have a CPAP machine. Yep. You'd be looking for some disturbed breathing, kind of like a coughing, gurgling noise. Mm-hmm. And then you would look at their eyes, right? If their eyes are shut and you were to, if they were unconscious and you pulled their eyelid back, their pupils would be so small they would be like the point of a pin, right? Wow. Okay. And so that's how you tell. The eyes give away a lot of things. They'll give away what type of medication someone is on. Now, not the exact one, but we can break things down in different categories. Yes. So stimulants, for example, like caffeine, or one that I personally take for ADHD, attention deficit hyperactivity disorders, Adderall, right? Mm-hmm. So that's an amphetamine, right? So that will make my pupils very large, right? Because it's boosted my system, and it wants more light to come in, so my pupils are huge, right? Because I need to see what's going on around me. Opioids slow breathing and slow your body down, so they don't need as much light, so they bring it down. So pinpoint pupils, slow, very, very unresponsive breathing, shallow breathing. And then also they're not going to be responsive to what we call as the sternum rub, okay? So essentially if you've got someone, and first responders will do this too, if you have someone who you suspect is overdosing or is unconscious, you don't want to walk up and kick them in the ribs to try and wake them up, right? That's not a nice way to treat someone, number one, but number two, you could do some damage doing that. Yeah. You don't want to do that. So what you do is you take and I know we're on a podcast, so you can't see me doing this, but if you could imagine making a fist, right? But not your knuckles. You want to use the bridge of your knuckles on your fist, right? And you want to take your hand and you want to take the edge of your finger, not the knuckles, the underneath part between your fingernail and your knuckles, and you want to rub that middle part of their chest. We call that the sternum. It's like the chest plate, the breastbone, right? And you want to do that up and down gently, right? You don't want to try and tear their skin off, doing it really hard, and you want to try and wake them up. You want to say, hey sir, hey ma'am, are you okay? Are you okay? And normally first responders can do that, or they'll do like a collarbone tap to kind of elicit some pressure and wake the body up. And normally people are unresponsive to that, especially if fentanyl is involved. Yeah. We were talking about, Dianne was talking about fentanyl. Fentanyl is so potent, Will, that, we were talking about, is there a way to see if it's in a pill or not that it's been put in? Absolutely not. It's the size of a grain of salt, and about 5 or 6 of those grains of salt is enough to be fatal to most people. It's 100 times more potent than heroin.
Really?
Yes.
And you can just order it from China?
Yes. Yes. You can.
As easily as somebody could order something from Amazon, you could order from
Yes.
China, really.
And what's really scary about that is the batches that come over. There could be 100 good batches that were, whatever they were made up to be able to provide the boost that people are paying for. But a bad batch could come over and be enough to kill 50 people. And that's what we look for as hot spots in our regions, where we just had a bad batch go through Henderson County, I think in Decatur County, and I know we had one in Madison County. And that's when you see a cluster of overdoses, usually people who are together, you know, and they'll actually die from it.
Yeah.
And what's really scary about the fentanyl is because it does provide such a boost. Drug dealers are cutting all their products with it, not just the opiates, but they're also cutting their meth, their cocaine, weed. We've seen overdoses for people who are just never used any other drug, just smoked weed. And their weed was laced with fentanyl, and they died.
It's terrifying. It's absolutely terrifying. So you said naloxone is a life-saving drug. Is there a time limit of... Obviously, when somebody has passed away, they're past time, but is it? What are the signs that people look for to know when they can or should administer it, and how long do they have?
I just want to go ahead and lead off by saying, if you suspect an overdose, you're not going to be able to tell. You're not going to be able to tell what all someone has taken if it's already in their system. Okay, like the eyes don't lie normally, but what we're seeing now is stimulants, like cocaine, methamphetamine, and fentanyl added to it. So you have a stimulant, and it's opposite an opioid, right? You have something that makes your breathing go up, your heart rate go up, and then they add something that makes your heart rate go down and your breathing go down to kind of balance out and give you this awesome euphoria. So sometimes you don't know what they've taken. If it's a stimulant only, if someone has let's say they've taken cocaine, or they've taken they got their hands on someone's like I just said, ADHD medication, and they've taken a bunch of it and they don't need it, they could overamp and they could overdose off of that. Overamping is a stimulant overdose, where your heart rate can't keep up with what your body needs, and it can lead to cardiac arrest sometimes. But basically, if they're overdosing from an opioid, there's a critical window, because when you stop breathing, you have about 3 to 5 minutes until oxygen deprivation starts to damage the brain on a chemical and just a baseline level, to where there's no going back. There's brain damage that is irreversible. So 3 to 5 minutes is about that window. But regardless, if you see someone in that position that I was talking about, small pupils, big pupils, whatever, if they're passed out, if they're struggling to breathe, if they're unresponsive, give them Narcan, give them naloxone.
No matter what.
Because it's not addictive, and it doesn't hurt anybody.
Well, it won't harm anyone.
It's just like an Afrin nose spray. If you've ever done, I get the no drip kind whenever my nose is stuffy, because I don't want it to go down to my throat, because it leaves a sour taste in my mouth. That's all that this nose spray will do to someone. You cannot overdose on it. You cannot use it too much. It is not addictive.
So where can people get it, and who should carry it?
Absolutely. So there's a couple different options for getting it. Number one, first and foremost, what we encourage people to do, just because we, as a team of ROPS, Lifeliners, we're very limited, right? There's only 20-something of the ROPS team across the entire state. There are 4 of us in Region 6 South here in West Tennessee, but there's a standing order in the state of Tennessee where anybody who has insurance can go. And I just did this for myself the other day. I went to my Walgreens and I picked up my normal medications I take, and I asked for a prescription for naloxone, and they will give it to you. You just have to pay your copay or whatever. Your insurance will figure all that out. I'm not very savvy on all that, but they will provide that to you so that you can carry it with you. And they will show you how to use it as well if you ask them. And if they don't, call us. We'll show you. We'll teach you how to use it. But that's one way. So any pharmacy, there's a standing order. You can get it, no prescription needed.
Okay.
Option number 2 is through, if you have TennCare, right, which is a form of Medicare or Medicaid, through the state of Tennessee. So you can get 2 units of naloxone, so 2 4-milligram nose sprays a month on TennCare, no cost to you.
Okay.
And that also goes along with another aspect of TennCare, which is called Cover RX, which is another form of a way to get your medication paid through the state insurance of TennCare. And if you need more information about that, I'm not 100% up to speed on it yet. I need to learn a little bit more, but it covers more than just naloxone.
Yes.
It covers a lot of medications. I
Gotcha.
scanned through the list, and like 2 of the 3 of mine were on that list.
Yes.
You know, so that's another good way. And there's information on tn.gov, the state website about
Great
that.
resource.
And maybe when I'm done talking about the third way, Dianne could explain more about that. But and then the third way is to call a regional overdose prevention specialist. We call ourselves the ROPS.
The ROPS, okay.
So ROPS. So if you don't mind, could I give my phone number?
I was
Could me
just
and-
actually about to ask.
Could
if
me and
people
Dianne
had-
share our phone
Yes.
numbers and our emails?
Yeah.
Absolutely.
Lay it on me.
So if you need to get into contact with me, I cover, well, regardless of what counties I cover, I'll just give you my phone number and then
Right.
we'll get you to the right person. So 731-694-1335.
And listeners, that's going to be in the description. So if you're looking for that, just look at the bottom and you'll see Chandler's phone number.
Mm-hmm.
And Diane's number
my
as
phone
well.
number is 731-694-3161. And I'd just like to just put out there that if anyone has anyone, like a loved one or someone who's at high risk for overdose or has a substance misuse problem and is looking to get help and doesn't know how, I'll be happy to talk to you and try and find you treatment, residential treatment, sober living, whatever, the case may be.
That's amazing. I'm so thankful to have, 2 people that I know doing this kind of work or doing the Lord's work, as they say.
Yes.
And
Yes.
it's an honor to have you guys in today talking about this. It's
Thank
very clear that you guys are both passionate about helping people, and it brings a sense of comfort to me knowing that there are people like you guys out in the Madison County and West Tennessee area doing what you're doing. So thank you for what you're doing. It
Thank you.
takes
Thank
a
you
village for sure, and
Thanks
y'all
for the
are doing a
opportunity.
great job.
Yeah, thank you for giving us a platform to share this.
Yeah,
with
absolutely.
People. So thank
this
you,
is
Will.
This has been great. We'll do this again sometime if you want.
Absolutely.
Talk about more stuff. Well,
Yeah.
great. Well, listeners, like I said, if you're looking for their phone number, I'm actually going to put it in their description, their names. If you look for their names, their titles, their numbers will be underneath their names. And like I said, if you have questions for them, questions for me, feel free to call them or send us an email at wetalkhealthpodcast@gmail.com, and we will get your questions answered. Chandler, Dianne, thank you all so much for coming in today. This has been a real treat.
Thanks, Will.
Thank you, Will. Appreciate
Absolutely.
you.
Thank you. And this has been another episode of We Talk Health.